All right. Uh, Good afternoon, everyone. My name is Vikram Joshi, and I've been associated with Sarthak since 2012, and I've been helping Sarthak Jaipur Center in the capacity of Rajasthan State Advisor. It's my honor and privilege to be part of this discussion, which is Early Intervention and Inclusive Education panel covering more disabilities under RPWD Act. It's also my pleasure and honor to introduce our today's moderator, Lady Anuradha Bhavnani ji, who have worked across sectors from oil and gas, energy, waste to value, urbanization, sustainable cities, and agriculture. Anuradha ji has also had wide experience in non-executive board roles with non-for-profit and profit, Shell Foundation, and many more. Her knowledge and her expertise will certainly help Sarthak in connecting the dots. So over to you, Anuradha ji.
Yeah. So thank you very much, Vikram. That was indeed a great honor and humbling introduction. Uh, I'm really excited about this panel discussion, and I would like us all together a warm welcome from cold Delhi and cold Gurgaon from all of you. I'm sure you are all across multiple cities. This virtual conference is a amazing experience for all of us to come together from across the country. And even our exemplary panelists who we will speak with in the next few minutes are actually spread across the country. So welcome everybody. Let me just, without taking much more time, introduce you to our eminent panelists who have loads of experience in the space, a lot of expertise in this field, and come in with a lot of passion and compassion to be able to take this conversation and help us understand the subject better. So let me start by introducing Aishwarya first, and let me start by introducing Nandini. Nandini Rawal is an executive director by of the Blind People Association. She has decades of experience, and clearly what fascinated me about her work was really the number of documents and papers and articles that she has written on this whole space really talks about the depth of experience and knowledge she has on the subject. I'd like to then introduce Dr. Suraj Singh. Dr. Suraj Singh is an additional professor of community ophthalmology with the Dr. R.P. Center for Ophthalmic Sciences, AIMS. And he too comes in with a lot of depth of knowledge in the subject. I'm going to not get into too many details about each one, so pardon me because I think we will have to just stick to time. I'd like to introduce the next person. 1 second, sorry, I'm missing out. Sorry, yes, so I'd like to introduce Aishwarya. Aishwarya comes in with nearly 8 years of experience. She has worked in the space as a rehabilitation counselor at the Institute of Vision Rehabilitation. What fascinated me about reading more about Aishwarya was she is also one of the few blind artists and filmmakers in the world and hopes to bring in inclusion in every field. So I just thought that was really, a great experience she came in from. I'd like to introduce Nandini Saran, who is the head of Center for Multiple Disabilities, NAB, Delhi. And she's a master's in life sciences and a special educator in this profession. She's working closely for inclusion for children with visual impairment and is also a coordinator for the Regional Learning Center. So welcome everybody, and I do hope we can make this a great learning experience for each one of us together on the panel, as well as all the rest, friends and colleagues who are listening in, and we are able to address some of the questions that they have in their minds. So let me start off by actually posing the first set of questions to Nandini and Nandita, and I'll leave it to either of them to take the lead. But the question really is, what do you think are the possible barriers to earlier intervention? And I'd like one of you actually to start off by telling me about the barriers that you think you've come up against, and how you've solved them in the COVID era, because this has been a very different experience for all of us. So either of you, please address that question for us. You're on mute, Nandini. You're on mute.
Sorry. Yeah, if you don't mind, I would like to go first, and we can then take Nandita. Nandita, is that okay? So I will talk of work during COVID.
Absolutely, ma'am.
Yeah. So I would a very good afternoon to all the people, and warm greetings in an otherwise cold season. And early intervention and COVID, two very, actually, I would say diametrically opposite things. Because in early intervention, you literally mean intervening in a child's development to provide support at an early time in the child's life. And it's designed for especially our infants who have a single disability or who have more than one disability. And the very definition of early intervention actually means that you go close to the child. And COVID exactly stopped us from doing that. Early intervention depends on early identification, which was extremely hampered due to COVID. So the crucial time of identifying a child early, possibly in the years of 0 to 6, which is the best time for early intervention, was lost. We could not identify children. A lot of children who were identified, say in 2018, 2019, could not get services. So a lot of the developmental time period of the child, which is best when it learns the best, where it develops the best, it was lost due to COVID. And early intervention is not a kind of service that you can provide very well through virtual means. It's very difficult to train young babies or students with severe disabilities, students who have lesser concentration or who are hyperactive. It's very difficult to do virtual training. A lot of our students need, hand over hand assistance, as we would call it, where a teacher has to guide the student with holding the hand or holding the body. All that was not possible during COVID because most centers were closed. Secondly, a lot of centers who were open were so afraid of this problem of the disease, COVID being such a scary kind of thing. A lot of people did not start their programs. Students could not come to the centers because local transportation, especially in Ahmedabad, or our local transportation was closed, as in many other cities. It remained disturbed for more than a year. So students who were poor, and most of multiple disabilities children come from very poor areas, so they could not bring the children to these centers for treatment or training or intervention. We tried doing a lot of the training through the virtual means platform, but a lot of our parents did not have Android phones and they did not have money to recharge. We had a lot of parents who were landless laborers or who were laborers. They were out in the field. The grandparents were not able to handle smartphones or were not able to handle a child with multiple disability during virtual training. There was a reluctance on the part of family members to visit centers and also part of the staff to visit such children in their own homes. There was a restriction of movement of staff due to the lockdown. There was a great isolation of family members due to the COVID infection, and our children have to touch, have to be close. Children with hearing impairment have to be close enough to be able to read the lips, or if with a multiple disability, they have to be really close. So social distancing became literally true. It was actually physical distancing, which was supposed to be done, but it really led to social distancing because our children could not be alone or together with anybody. They had no friends. They could not go out and play. The other siblings in the house were, there were too many people in the house wanting virtual sessions. So it all became a very big problem. As I said, they did not have money to recharge. There were not enough strategies, but we did try to make some change. I'll just end before I hand over to Nandita that Blind People's Association started something called a learning laboratory, where we put up a lot of videos of specialists teaching parents how to deal with different aspects of the child. So if the child needed toilet training or eating or balancing or positioning, we did it through videos and put it on the net and on YouTube. We also asked for videos from parents doing the actual intervention at home. The videos were uploaded to us and on our website, and we corrected them and told parents how the instruction was to be done. So through troubled times also, we did develop our own system of reaching out to people. And I would say these are the pros and the cons of COVID. But yes, early intervention was greatly hampered due to COVID. And thank you very much. And Nandita, you can add about the other aspects related to early intervention. Please go ahead.
Yeah, thanks,
Thank
Nandini.
you,
I
ma'am.
think, yeah, Nandita, I think, the wider aspects beyond COVID, I'm sure continue to be adding to those challenges. These were add-ons, literally, as what Nandini said. So would love to hear your, experience in your learnings.
Thank you, Anuradha. And thank you, Nandini, ma'am. Actually, as she said, the whole concept of social distancing and providing touch-based intervention to small babies with multiple disabilities, it is actually a contradiction in itself. But I wouldn't, since ma'am has already covered a whole lot of aspects, what we as organizations, as parents, as children have suffered during COVID, I would just like to ponder on the concept of early intervention prior to COVID. Now, when we are talking about barriers about early intervention, the two barriers for early intervention that strikes to all of us is acceptance by parents, as well as early identification. If we don't have the means and the wherewithal to identify small babies with multiple disabilities, with visual impairment, with deaf blindness, the earlier we identify, the earlier we are able to reach out. So the first point is identification. And here again, I would say that most of our services are very, very metrocentric. In pockets, we are working in pockets where there is more awareness, where people, where the NGOs or the state governments have been more proactive. There has been improvement in the early intervention, reach out to small babies, but it is still in pockets. The wider reach is yet to come. And for that wider reach, if I take the metros, as a parent, there are doctors on the panel, they would bear with it that the moment you use the word rehabilitation, parents find it very, very difficult to accept the concept of rehabilitation. They are looking for cure. The immediate point that a parent with a small baby goes to a doctor, they are not looking for rehabilitation. What they are actually clearly wanting is a magic pill which says that your child with certain limitations will be cured. If one doctor says no, they visit other hospitals. In that period, crucial time, which otherwise would have helped the baby in early intervention is lost. So here is one set of parents very aware, have the means to reach out to the best of doctors in and maybe outside the country as well, are first running pillar to post, looking for a magic pill, looking for cure. They would rather not dwell on the aspect of early intervention. They'd rather dwell on some kind of cure. Coming to the pockets where we still don't have the method to identify, the method to sort of get the children out from the rural areas or in small cities, get them to a rehabilitation center. Here, I would say that identification becomes crucial. We've had, through the governments, we've had Rashtriya Bal Seva Kendras, RBSK. They again have worked in pockets. The kind of reach that an Anganwadi program has, the kind of reach that we have for our vaccination, for our inoculation setup, we still don't have that kind of reach to identify babies who are in the need for early intervention services. So my take would be that we, as advocates of this early intervention program, as professionals working closely with government hospitals, as NGOs who have had the experience of working with children with multiple disability or disabilities, should actually be a pressure point wherein we have real countrywide training of Anganwadi workers, where they are able to, because we know Anganwadis are there all over India. Why can't we give them the teeth to identify those crucial babies who are in need of early intervention, and maybe then get them to the centers where we are talking about intervention? So barriers, I would say, the crucial time, that is with acceptance of parents that the child actually needs more than a cure at this stage. Also, the process of identification needs to be strengthened. And once the identification is there, then we would have the problem of actually developing early intervention centers, maybe linking with the primary health centers. We have PHCs, I know, all over the country. So an Anganwadi worker or a person in the PHC could preliminarily develop an early intervention center in a particular block or a village or a city and provide those services. Because right now it is, as I said, we talk about the aspect how crucial early intervention is, because that is the time when the child development is at its best. So that to prevent the loss of that crucial time, I think these two aspects really need to be dwelled on.
Thanks, Nandita. I think that is, your points are very well identified in terms of identification and how can you really build an ecosystem to take some of this forward in terms of using existing infrastructure and building on it. So thank you very much. I'd like to right now, move on to Dr. Suraj Singh, who has great experience and expertise in this field, and really understand from him what he thinks is the role of medicine in all of this topic that we are speaking about. And in your experience, where do you think are the gaps? So Dr. Singh, given that we are going to be timed out at some stage in the next 40 minutes, I'm going to request you to keep your conversation to about 4 minutes right now, and then we'll catch up again for further things. Thank you.
Yeah, so thank you. First of all, thank you for having me in this virtual platform, which I thought is very, very important, as of today, because that this COVID pandemic. So now coming to the role of medicine, so when you talk about the role of medicine, so the first of all, you can categorize into different dimensions. So first we have a promotive, the preventive, and treatment and rehabilitation. So which area we should focus when you talk about the, medicine that can possibly, intervene when we want to, treat patients with disabilities. So the first is the promotive. So it depends on the what kind of disease the child or someone is having. So some disease which can lead to disability. So if we prevent that, if we identified early the stage, and then of course we can prevent the further deterioration of the disease. For example, a child with the retinopathy of prematurity. So this retinopathy of prematurity, if we identify early in the case, and then it can be treated timely, and then the further vision loss can be prevented. Similarly, other diseases as well. So there are so many factors which can lead to that disability. So this can be prevented at the perinatal periods. To support, for example, cerebral palsy. So cerebral palsy. So similarly, other disease also, and of course there are some problems that inherits the family genetically issues. So that may not be possible for that. So rehabilitation is the only option that we can thought of. So so here, that's the role of medicine. The most important part is treatment. Of course, for the disability, sometimes it is not possible, but the preventive and promotive. So these two factors. So we focus in our setup to prevent the further disable. And so then there is the one aspect. And the second one is if someone comes to me, who have already problems, and then for that, so rehabilitation. So as one of our panelists rightly mentioned, the acceptance is very challenging for the parents. So the acceptance is so difficult if someone is having problems, and the retinitis pigmentosa, cerebral palsy, or retinopathy prematurity. This acceptance is very, very difficult, challenging for us. So our in hospital, so we try to counsel the patient, the parents, the caregiver, the family members. So you need to accept at this stage. So someone has to go out of those concepts that okay, this child can be, I will go to pillar to post. This is exactly true what is we are facing in our hospital. So parents keep thinking, okay, my child, some kind of magic bullets, some kind of magic pills. Exactly what one of my panelists said. So, and many of them, they spend a lot of money. So, and 2 days ago also, one parents who suffered from the child suffered from retinopathy prematurity, and then the parents said, "Sir, I have spent more than 25 lakhs." So more than 25 lakhs to be able to cure this vision problem. So I cannot do anything. So at the very first point, so we need to counsel the patients, the parents at the hospital, because hospital is the first point that usually contact by these parents. So in the hospital itself, if we are able to counsel and then make them accept what is happening to the to the patient. So this area, we need to work on. And then sometimes parents are very much they are not ready to accept for anything. So they will cry anything. Okay, my child will remain blind, and then sir, do something, that kind of thing. So this is also another area to counsel. Sometimes we can group counseling. So this is one of the very important area to be focused for those child who visit our hospital. Rather than spending money from going to other hospital, so that the mindset should be go to the direct in terms of educations, in terms of daily livings and performance, motor skills. So other area, the rehabilitation. So this area is we're working. So this is the one of the very important role in terms of preventing this further disability and to improve the quality of life. Yeah.
All right. So thank you very much, Suraj. I think the point that you brought out is echoing what was said by the earlier panelists too, which was, the role of acceptance, awareness, and counseling is very key to this whole issue. I'd like to now actually invite Aishwarya to share with us the role of assistive technology in education, and what has been her experience in this whole space. So Aishwarya, over to you, my dear.
Thank you so much for the question. Good afternoon to one and all present here. Well, I think assistive technology plays a very important role in inclusive education. If I could tell you about myself, I'm a late blind, and I had pursued my education, half education when I was sighted, and the other half when I became visually impaired. And I would like to bring this, incident. Like I was supposed to fill in a bank form and submit it to the college, and when I called them up, they said, sorry, because you have vision impairment, you'd have to come to the college and then do the necessary documentation. So for those people who are sighted, it was easy, just go online and do the payment. But for me, I had to travel all the way around with a sighted guide and then do the payment. So I think when inclusive education, when somebody talks about it, uh, everybody should be included, like inclusive. Like example, another incident, like Google wanted to design a mobile phone. As soon as you put it into your pocket, it turns off, the screen turns off. So it was a cool idea, and everybody thought, okay, let's go with it. But one of the female designers said, hey, it is good for men to put it in your pockets. How about women? I mean, where do they put?
Don't have pockets.
So that was the question. I mean, I think whenever somebody thinks of inclusive education, it should be for diverse candidates, and and that's why assistive technology, like example, I mean, my recommendation would be having a disability unit. So right from the child is admitted into the school, so what are his needs? Like each child with disability, it could be hard of hearing, visually impaired, each of them should have an option. Okay, I come under this category, so what are my facilities? The college themselves should know, okay, this child, we'll be providing, if it is visually impaired, okay, we'll be providing audiobooks, we'll be providing, we'll have a facility for using screen readers and screen magnifiers, so that they can make use of these. Like it could be even braille, it could be large print. And coming to also the infrastructure, it is also very important. If supposing this child is going to a classroom, what classroom is it? Are there braille labels on the doors? Are there braille labels on the doors of the staff room and principal? These are important things to consider when it comes to inclusive education. And also, in not just academics, I think even when it comes to athletics and art, people should be encouraged, equally encouraged, whether the child is sighted, or I mean, whether the child is not disabled or has a disability, they should be included and given equal opportunity. The Right to Education Act 2009, it says there's compulsory and free education for all children in India, whether they are disabled or not. But the statistics show that only 5% of persons with vision impairment or disabilities have access to education. So that is a big point to consider. Why is it so? So the enablers here are providing training to the teachers who take care of education both in mainstream and special education system. So what that is one enabler. And the other is providing assistive technology during, like, each child, understanding what the child's need is and providing that to the child. And at the same time, the government policies that are there, like example, I'll finish with that example. There is uniform guidelines for persons with disabilities, which talks of these are the facilities for children, for the students with disabilities. They can get a scribe, they can use a laptop during an examination. But how many universities, how many colleges, schools allow children to use laptop? So these are questions to think about, ponder about. And I think it should be made uniform everywhere, and circulars should be sent, and awareness should be spread about this particular topic. Thank you. I finish with that.
Thank you very much, Aishwarya. I think there were multiple points that you made around being all inclusive, diverse, to actually include the whole spectrum. And I think, definitely the points that you made about the role of various ecosystem partners as enablers and policies. But closing out, you mentioned more around the advocacy role and the role of awareness building in really making this universal education for all. In a way, those who are challenged and those who are not all need to get educated at an institutional, individual, government, policy, all levels. And that's a task that needs to get accomplished really soon. So I think, I have one round of questions actually to all the panelists, and I'd like to give you maybe a minute or two each, not more, is that, if you had a wish list around one area of transformation, just one area of transformation, in one line, could you tell me what that area of transformation will be? And that wish list we would like to then go out and, build on as a group. So maybe I'll start off with alphabetically this time. Aishwarya, over to you. Come up with one point in your wish list which you think will be very transformational.
I think making the websites, that right from these Google and whatever the classroom at setup is, making them all accessible. So that is very important.
Thank you. That's great. May I ask Nandita or Nandini? I can see your Nandini. Are you there?
Yeah, of course. I would say my wish list would be that, disability should not be seen as something which is different. It should be part of inclusive development. Why should it not be part of it? Every building, everything should be accessible. So once we take that as part of our fabric, I think everything would follow.
Great. So mainstreaming, very important from your perspective. Nandita? Sorry.
Yeah, very much there.
My
wish list.
Just one point.
My wish list would include how we are able to achieve inclusion for children with multiple disabilities, children who are still not there in the mainstream system. How can we develop an ecosystem where they are included, maybe not just in terms of education, but otherwise also? So an ecosystem which is more inclusive for children with multiple disabilities.
Fantastic. Dr. Suraj Singh.
Yeah. So thank you. That's the really fantastic question. So, the foremost target is creating an enabling environments with the help of assistive device. So when you talk about the disability, the first of all, we should come in our mind that assistive device. So of course, the other area also important, but without assistive device, it's not possible to create enabling environments. So that is my first, we need to work to improve the access to the assistive device, which will help to create enabling environments. That is the
fantastic.
Yeah.
Fantastic. Vikram, given that you have been so closely associated, I'd love to hear, any thought you have on an area of transformation.
Well, my wish list would be that, the moment we start with the word disability or differently abled, I think we need to change our vocabulary. We need to change the way we look at, these kids or children with have issues. Let's we call it issues. But the moment we have, some negative words, I think my wish list would be that we should eradicate all the negative words which is associated with this issue.
Okay, fantastic. I think we have a fairly elaborate wish list, and maybe I can add my own. And I know that many of you have brought it up in our discussions, and definitely have it on your mind. That in my wish list, I think this is all about all of India. So we need to really be able to reach out to the last mile, which currently is, like was shared with one of our panelists, is very metrocentric. We're a huge country. And, to be inclusive, we have to really reach the last person on this, at least in this country, which is not a country continent. So I think, the points you've all brought up are, I'm sure, things that we can collate and take back to take some further action on and build on some of these issues. And I love the point that Aishwarya brought up on websites. And, this is something that I think all organizations, institutions, individuals need to be aware of how you can create a communication platform that is more inclusive. So in this digital age, these are some of the things that are kind of, non-inclusive currently, but we need to reach out to the universal organizations to take this forward. So I'd like to reach out now to Bhavna. Bhavna, are there questions that have come in from the team?
Yes, ma'am, we'll share over your chat box.
Okay. So in the meanwhile, any last one final thought that any of you have while Bhavna shares some of the questions with us? Any of you? Any last point?
Can I add, please?
Yeah.
I think, especially in our country, this is my another wish, sorry, but I think the stigma about disability should be completely eradicated and everybody should be treated equally. Yeah, thank you.
Right. So,
ma'am, please check your WhatsApp and chat box.
Yeah, I'm just doing that, Bhavna. I'm just doing that. I'm sorry. I'm not such a great tech person, so I will just look. Give me a second. So I think one of the questions that has come up for the panel is what more can be done by the government and also other institutions to improve the current scenarios for PWDs, and so making schools accessible cannot be enough. How do you think? Okay, so I think that's a very relevant question. I think two very relevant questions. One was really around the education, and two is about, getting schools ready is one part of it, but how do you get the students who are not disabled, who do not have any special challenges, actually, how do you make them more sensitive about being more inclusive? So any thoughts that any of you have around this? How do you sensitize other children?
I would think that nothing succeeds like example. The moment you put in a child with a disability with the other children and you are hand-holding the child initially, you are also involving other children through innovative methods of play, so that the child doesn't become an oddity, the child with the disability doesn't become an oddity, but the things that he uses become more of a curiosity value for kids without disability. For example, a brailler or sign language. You can transform this into a play so that it becomes interactive and the child with the disability is more easily accepted, because we show that children are more similar than different. I would say these are the strategies that we use.
Right. And one of the questions asked is around what are those things, what are those one or two things that the government should do right away to make it a better world for PWDs?
Yeah, may I?
Yes, definitely, Doctor.
Yeah. So, of course, that as far as PWD is concerned, that the government is currently doing a lot of, work. So the first of all, the assistive device, the government has already prepared the national essential list for assistive technology. And at the same time, AMC is, as an apex hospital, so the National Center for Assistive Technology for Disability. So it will come up in 3-4 years. And other things like the government, of course, in the government also, that one ministerial division cannot, do the entire the welfare program of the disability, because disability is so diverse. You need the various divisions, not only the Ministry of Health and Family Welfare, not only the Ministry of Education, ICRD Ministry, not only the Social Welfare, Transportation. So there has to be some kind of collaboration, of course, at the apex level, at the nodal level, and then and then that the needs of those disabled, their needs is sometimes is very customized. So in hospitals, what sort of the service should be available, and in terms of their accessible, in terms of their healthcare access, in terms of, so then the Minister of Health and Family Welfare, they can thought about it. And while for the transportation, so then the Ministry of this relevant ministerial division in the government of India, so they can also thought of, okay, that accessible transportation system for the person with a disability. So and at the same time, we also keep in mind that other organizations, because everything cannot be done by the government. So there has to be some kind of collective efforts from all sectors, the government, the privates, the NGOs, the civil society. So there has to be some kind of efforts from the all sectors, and then only this inclusiveness of the for the person with disability can be thought of. So that is the point. But the only liquidity in the government sector is there's a little lack of collaboration in the top level. So there is a little bit of that we need to work to for advocacy. There has to be some good collaboration, either in the form of implementation, resource, and and then providing service to the different sectors. So that we should work together. The one person, the aims cannot work alone. So that even though we have in mind, these are the things to be considered by the government. So advocacy has to be, from the all, we need to create an evidence as well. Without evidence, we cannot just, okay, improve the transportation system. Okay, you do this, that, and then we cannot do that. But there has to be some evidence, research-based evidence. So once we have a research-based evidence, okay, this will improve the performance of this particular person, or this person with disability, then only the government will take up. So for that, we need to work together.
Thank you, Suraj. I think that was very well said. Nandini,
can I just add a sentence, Anuradha?
Sure, Nandita.
Yeah, taking from what Nandini ma'am said, inclusion, my experience is that school children take are more, they are very accepting to a child with disability. The sensitization has to have at the management level, at the level of adults. So children are easily accepting their peers. There I feel the more you mingle, the more the child gets used to this child with disability, and they are very sensitized right from an early age. So the sensitization more has to be at the level of the management, especially in schools which are still not open to inclusion. So therein, I think we all need to have our roles wherein we can reach out to more schools and more managements and sensitize them for the inclusion for children with disabilities.
True.
Right. So I think, the points all of you have brought up are really help us create an action checklist in a way for us to build on this collective thought process and take some of it forward. But I'd like to kind of pose a question, which is a question on my mind, to maybe Nandini and Aishwarya. If you can, in the next, give each other just 2 minutes each on bringing up any best practice from within the country or anywhere in the world, which you think has been implemented and we should try and implement it for PWDs, especially for young children?
I would like to say that we should walk the talk. In most cases, we talk that the government is not doing this, is not doing that. But if we actually develop a model that is practicable, doable, replicable, it does happen. I'll give you one very small example of a good practice. We spoke to the government of Gujarat, and we felt body workers, as Nandita has said, would be the right people to identify children who are in the age group of 0 to 5. The government said, we are ready to do it, but we don't know how to do it. So we said, we'll join hands with you. We developed a blueprint for a few districts, and our staff went and trained the staff of the government, sensitized. So you sensitize the bureaucracy and you train the lower staff. That is the two-pronged strategy. And that's how we could identify more than 5,000 kids in the age group of 0 to 5 years, and we could ensure that they got early intervention. And the same hospitals and the same staff, they cooperated beautifully, because it was not as if they didn't want to do. It was because they were not aware of how to handle these children. So I said that if this is one good practice, people can replicate it all over India. You can train all these Panchayati Raj workers or Anganwadis or whatever, and they do deliver. So the fruits reach to the doorsteps of people with disabilities. That is the main thing.
Perfect. Aishwarya, do you have any best practice?
Yes, I do have. There are two things. One is including a disability unit in every educational system. Any student who goes there, they just contact the disability unit, and then they take care of everything from A to Z. They take care of everything from their admission, from their the accessible books that they get, the way they prepare for the exam, to get information on the government policies. So that actually very interested me. Then when I researched and saw that there are hardly any units here in Indian schools, colleges, and universities. Secondly, I think inclusion of the expanded curriculum in the education system. Like if I would talk about the vision impairment, there are different topics like orientation and mobility, independent skills. So this should be part of the education system, so that the child, whoever comes there, would be able to be trained on these things. And not only that, the classmates, like when siblings are there together, the sibling would know, hey, this is what my brother needs, this is what my sister needs, and let me help him out. Same way, when this is made part of the curriculum, the other child who's not disabled will understand the needs of the child who has disability, and that way I think it will promote inclusion.
True.
Really fantastic thoughts, Aishwarya. Thank you very much for that.
Thank you.
I'd like to really thank the Sarthak team for bringing together this really knowledgeable and experienced group of colleagues around the table to share their views, their thoughts, and I'm sure we have an opportunity to create an action plan to take some of these points to the next level. Over to you. So thank you very much, each one of you, to really give us your valuable time today to come across and share and meet with us on this panel. I'd like to go over back to the Sarthak team.
Thank you, Anuradha ma'am. We will be having a memento handover section. I'll request Vishal to display the presentation. Ma'am, you can read the name.
Thank you, Anuradha, for bringing us and in one chain and making it so seamless. Thank you so much.
Thank you. Thank you. Thank you, Sarthak team, as well.
Thank you.
So thank you, everyone. And thank you, Sarthak team, for bringing us together.
Vishal, you may go ahead.
So Nandini, this is for you.
Thank you so much.
Thank you very much.
Thank you so much. My pleasure.
Thank you.
Thank you. That's for you, Suraj.
Yeah. Thank you, Anuradha.
Thank you.
Thank you, ma'am.
That's for you, Aishwarya. A trophy for you, Aishwarya.
Thank you. Thank you so much.
Sunam is not there. Next one. Yes, Nandita, that's for you.
Thank you. Thank you.
And Vikram, for taking us through the whole session, the beginning.
Thank you so much. Thank you, everyone. Thank you.
Thank you, Anuradha ma'am. This is from Team Sarthak. Thank you for.
Thank you very much, and
clap for that.
we are well within time.
Okay, thank you.
So thank you very much, all of you, for this really enriching and valuable discussion. Thank you very much.
Great. Have a good day. Bye, everyone.
Thank you.